All right, when we do a crown prep on a patient's tooth, the first thing we need to do is take a preliminary impression. This is important to take a preliminary or a pre-impression because we need to get a copy of the tooth, the creation of the tooth in its entirety. We don't want to forget this step and then the doctor cuts down most of the patient's tooth and then we don't really have much to go off of as far as making a temporary crown. So a preliminary, every time you hear the word preliminary, think of a temporary crown. So this is a type of preliminary impression. Okay, then once the tooth is prepped and we're ready to pack cord, all right, this is what it'll come in. There's different thicknesses. Usually you'll have probably a 0 and a 1. You'll pack the 0 first and the 1 second. You'd cut it, this is a pretty long piece, you'd cut it about half as long as this, maybe even a little bit less than half. Basically as long as you think it takes to go around the entirety of the tooth. With it, you'll use the cord packer, okay, to put it into the gingiva. And then what you want to do is you want to soak it in Hemident, because when we put this cord down into the patient's gingiva is already irritated in the first place. They could have decay and stuff irritating the gingiva as well, and so it could make it bleed pretty easily. This stops the bleeding, so that way we can get a good final impression. So we would soak the cord in the Hemident, and then we would use the cord packer to push the cord material. I don't know if you can see this very well. I'm going to have to turn it so I can see it. This is something you should get lots of training on with an ETA or a dentist before you attempt it on a patient, because you can damage the patient's gingiva and there is some technique to it. It's pretty different doing it on a patient than it is on a typodont, but basically what you do is you push the cord down. It's been a while since I've come. All right, so we pack it down into the gingiva, kind of coming at an angle like this. I'm used to working from the other side. There we go. Okay, very gently. You always want to make sure that you're using your fulcrum with this, because like I said, this is sharp. This can actually cut the patient's gingiva. If you're not using your fulcrum and your hands floating around, you can easily slip and slice them. Then they could even have to get stitches. We don't want that to happen. So we would pack 2 pieces of cord in here, all right, counting as we go in. So we would count 1 piece of cord going in, and then 2 pieces of cord going in, right? And then we would have the patient bite on a compression cap. So the compression cap goes onto the tooth, the patient bites on it for 3 to 5 minutes, all right? What this does is this displaces the gingiva around the prepped tooth. So the gingiva flares out. The pressure helps with that as well, and it helps with, all of this helps with the bleeding and with the flaring out of the gingiva. And so when the patient's done biting on the compression cap, and you go to take the cord out, always count. If you counted 2 pieces going in, you need to make sure that you count 2 pieces going out, because it's easy to accidentally leave a piece in there. Sometimes you can't see them. Don't throw them away. Always leave them sitting on the counter so that way everybody knows that you got all the cord out. Once the cord's out, the compression cap is off, the gingiva will be completely flared out, and it will open up the margins of the prep so we can get a good and detailed impression. All right, once that's happened, what we do is we take our impression gun. This one is for the temporary material, but it'll look pretty similar to this, okay? And we use heavy body. This is the heavy body. This one's pink, but it depends on the brand once again, okay? This is thicker, kind of fluffier. And we use light body, all right? This one's purple, but once again, it depends on the brand. This is thinner and runnier. So this is for the bulk of the impression, the heavy body. The light body is for the detailed portion of the impression. You would load the heavy body onto the triple tray on both sides, okay? At the same time, the dentist or the ETA would be extruding the light body down into that flared out gingiva on the margins of the prep all the way around, trying to not get any air bubbles in there, okay? So then they would be finished with that portion. The patient would bite down on the heavy body like this. You would wait 3 to 5 minutes depending on the brand, but you have to make sure that you set a timer that you don't take it out too early. What you should be left with is called a final impression. This will not dry out like alginate. This is meant to be mailed to other states to make a crown with. This one's pretty beat up, but you can see the green is the light body, the blue is the heavy body. So the blue is the bulk and it didn't capture a lot of detail. The green is the light body, it went into the prep, and you can see that margin, that crown margin right there where we packed cord and we opened up that gingiva.